Lenire by Neuromod devices uses dual-mode stimulation to soothe tinnitus. But what exactly is tinnitus, and how does dual-mode stimulation treat it? Let's start with the brain and how it responds to stimulus. Repeated exposure to sensory inputs such as sight, sound, and touch strengthens or opens new brain connections. These connections are also known as neural pathways. As this occurs, other neural pathways can become weaker. These changes are known as neuroplasticity and are essential for learning and development. Playing the piano is an example of positive neuroplasticity. At first, playing the piano can be difficult. Regular practice repeatedly exposes the brain to sound, hand movement, and visual sensory inputs. This reinforces piano playing pathways and can lead to better playing over time. Tinnitus, commonly known as ringing in the ears, can be a result of negative neuroplasticity. Hearing loss can cause the brain to compensate for a loss in a sensory input. The brain then creates a new sound pathway to replace the loss of sound, even when there is no external source. This is otherwise known as tinnitus. Many people with tinnitus will try sound masking to get relief. Sound alone can activate pathways to temporarily distract from tinnitus. However, adding a second sensory input keeps the pathways active for longer and in a stronger manner. Lenire's dual-mode stimulation combines two sensory inputs, sound stimulation and multi-pattern tongue pulses, to activate hearing and sensory pathways. This dual-mode approach weakens tinnitus pathways and helps the brain to stop focusing on tinnitus sounds. Tinnitus will still be present, but the brain will become less sensitive to it, which can dramatically reduce the impact tinnitus has on a person's overall quality of life. Learn more about the Neuromod's scientifically proven tinnitus treatment device, Lenire, by visiting www.lenire.com. Lenire. Soothe tinnitus.